All right, thank you for joining us for our educational lecture series on cannabis. Each session is designed to deliver a small, in-depth dose of cannabis education. My name is Candace Hawes, and I want to thank all of our customers from Bud and Bloom, the Pottery, and from the Pharmacy Santa Barbara in Berkeley. Today, we're going to talk about the endocannabinoid system. The endocannabinoid system is involved in regulating physiological and cognitive processes, including fertility, various activities of the immune system, appetite, pain sensation, mood, and memory. The endocannabinoid system is the reason why cannabis works in humans and in animals. This is a fascinating vital system, and I'm really excited to learn more about it from our speaker, Dr. Daniel Price, who is the medical director of Tikun Olam. Dr. Daniel Price was trained in emergency medicine at the University of California, Davis, and did a fellowship in air medical transport and trauma at Oregon Health and Science University. He worked as an academic physician at AHS Highland Hospital and Trauma Center in Oakland for 14 years and has authored over 40 scholarly publications. Dr. Price's work focuses on the use of portable ultrasound in emergencies and in under-resourced settings in Africa, Latin America, and Asia. He has also helped found Mobile Medical Media, which developed medical education resources for mobile devices. Dr. Price's interest in medical cannabis arose from his own experience with back pain and from seeing patients in the ER who could have been helped safely by medical cannabis, but were instead only prescribed pharmaceutical medications, which often limited efficacy and potentially offered severe side effects. He helped pioneer House Call, a telemedic cannabis consultation service with Meadow MD in San Francisco, where he has treated over 15,000 patients. He recently joined Tikun Olam as the medical director to help advance the science of medical cannabis. Now we're going to watch a short video on Tikun Olam.
Tikun Olam is a very personal thing. It's a one-on-one with the patient, because we want to make sure that we understand the efficacy and the treatment and how the cannabis is working on the human body. Tikun Olam means to repair the world, and that is exactly what our mission statement is to help people improve the quality of patients' lives, is to help people get better.
We have years and years of studies and years of data that we can sit there and show them, we've been at this a long time. We've done this with over 20,000 patients. And what we found is this specific strain with this particular method and dosage has been able to provide symptomatic relief. And I think that, to me, is the most powerful thing that we're excited about in California, is providing so many Californians a roadmap to a better quality of life.
I'm a cell and developmental biologist, and so I look at the root of all types of diseases from the cellular level. We want to know from the very cell how it starts and how that cell migrates, how it multiplies into becoming what we now know as disease, and that's all types of disease.
One of the ways that Tikun Olam is, in a sense, garnished this reputation of being the most trusted name in cannabis is that we've been at this a long time. We were the very first medical license issued in the world. And with that, we started immediately with understanding what the patient's ailments were and how the plant and these specific strains that we have in our portfolio, how they can improve people's lives.
We published an autism study. It was the largest study ever done in autism utilizing cannabis, and we saw very striking results. 90.2% of patients had an improved quality of life in just 6 months. I mean, what more should I say than that?
I oversee both the grow and the cultivation processes through multiple states, and we're absolutely delighted and excited to be bringing that experience and the medical and scientific basis that underlines all of our products and our programs here to California. My background is primarily in business and emerging markets and politics, and there were lessons learned from those experiences that are applicable to the cannabis industry. I realized the potential of cannabis to provide so much relief to people who are suffering, and to work for a company like Tikun Olam, who has been doing that for so long. It's really exciting to be part of that.
Tikun Olam, yes, it's science. Yes, Tikun Olam is medicine, but you've got to love the story. It starts in Galilee with basically a poor farmer who wants to help his friends and his family. And he is helped by scientists learning that cannabis can be medicine. It can help a lot of people. This is like a light for everybody else on the planet, that cannabis is medicine, and it's helping people now in Israel. Canada sees this, and they make a legal market in a continent-sized place. Come to Israel, embrace this light, and bring it back to Canada. That company goes on to become the first profitable medical cannabis company in Canada. It raises $100 million in the largest IPO that's ever been done, and then gets bought out for $3.2 billion just a couple of years later. That gives you a sense of the power and the dynamism that lies in the cannabis industry, not just in Canada or in Israel, but all over the world. And it's that kind of dynamism that we're obviously very excited to be part of here in California and in the United States.
All right. That's just a little bit of information about why Tikun Olam is such an amazing brand. And so we're really excited to have with us today Dr. Daniel Price. So please, doctor, take the floor.
Well, thank you so much, Candace. And one thing that I just wanted to add on to that video is that the thing that I love about Tikun Olam is that it is based on science. It's the only company where because they came out of Israel, they were able to do the research, and there are over 13 published studies in the peer-reviewed literature where you can actually buy the stuff that's been studied. That is just not true of any other company. So when you're looking for a company, when you're looking for a medicine, you want something you can trust. And you know that you can trust Tikun Olam because they've actually done the studies and that they've been peer reviewed, and that this is real medicine. And we're going to talk today about the endocannabinoid system. And I remember when I was first learning about medical cannabis, and I remember thinking to myself, this sounds so much like snake oil, because how can you say that it affects nausea and it affects mood and it affects pain and it is helpful in all of these different areas? How can one plant do all those different things? And it wasn't until I discovered the endocannabinoid system and that I realized the reason that cannabis can do all of these different things is that we have a physiologic system in our body that the cannabis plant can interact with. And that's called the endocannabinoid system. And the endocannabinoid system is this physiologic system that works with all of the other systems of the body. So the respiratory system, the heart, the cardiovascular system, the skeletal system, the skin, the immune system, all of these different systems of the body are interfaced with the endocannabinoid system, because the endocannabinoid system is the conductor of the symphony. If you think of all of these other physiologic systems of the body as being the players in the symphony, whether you're a trumpet player or a violin player, the conductor is directing you. And that's what the endocannabinoid system does. And the reason that it interfaces with all of these different systems is that it promotes balance. It helps the body stay in balance and be most productive. And it regulates sleep and mood and memory, reproduction, pain, stress, appetite. I could go on and on. The list is really, really long. And it's because the endocannabinoid system interfaces with all of these other physiologic systems of the body. And this endocannabinoid system is old. It has evolved over millions of years and is present in all vertebrates, from fish to humans. All of us have endocannabinoid systems, and it was discovered in the late 80s or early 90s over that period of time in Israel by Dr. Raphael Meshulam, as Candace mentioned. And it's relatively recent. So most doctors are actually unaware of the endocannabinoid system, not only because it's so recent, but also because it isn't taught in medical schools. Only about 13% of medical schools teach the endocannabinoid system. That's changing, but it's something that because of the war on drugs, it unfortunately has tragically been ignored. But there are over 21,000 peer-reviewed studies in the literature that look at the endocannabinoid system and cannabis. So it's actually very well studied, and we have a long ways to go. The problem is currently the way it's scheduled by the federal government, it's Schedule 1. And so that means it's essentially illegal to do research on cannabis in this country. It's a real tragedy. But the benefit of Tikun Olam coming out of Israel is that in Israel, they are much more forward thinking in terms of cannabis used as medicine and medicine in general. And so the research was able to be done in Israel, and we benefit from that now here in the United States as well. So in terms of the endocannabinoid system, the key word, the medical word, is homeostasis. Homeostasis is balance. I think one way to think about it is to use the metaphor of Goldilocks and the Three Bears, and that fable talked about Goldilocks coming into the bear's house and looking for something that was just right. The porridge was too hot or it was too cold, but she wanted it just right. That's what the body needs. The cells in the body operate most effectively when conditions are just right. So temperature can't be too hot, it can't be too cold, it needs to be just right. The blood sugar levels need to be just right, not too high, not too low. The cell operates best when things are in balance. And that is called homeostasis. And what the endocannabinoid system does is it works with all of these physiologic systems of the body to help bring it back into balance so the body operates most effectively. So there are three main parts of the endocannabinoid system. There are the endocannabinoids, which are chemicals in the body. They're messengers that you can think of as keys that fit into locks. The locks are the receptors. And Candace, go ahead if you wouldn't mind putting the image up on the screen. What we're going to look at here are the
Tikun Olam is a very personal thing. It's
Sorry about that.
There we go. So the endocannabinoid receptors are the second part of the system. So here we see CB1 and CB2 receptors. These are the two main receptors that have been discovered. There are other ones that we won't mention that are in the process of being investigated, but these receptors live on the cell membranes and they listen to conditions outside the cell. And under certain conditions, when it's necessary, they will transmit a message to the inside of the cell and produce an effect, whether that's a calming effect or whether that's an inciting effect. It's going to have that effect because the endocannabinoids bind to these receptors. These receptors are located all throughout the body. CB1 receptors are most abundant in the brain. Actually, let's go back to the endocannabinoids first before we go on. But these receptors are scattered throughout the body in all of the different systems. They live on the cell membranes and they allow different parts of the body to communicate with each other. So endocannabinoids are, endo means within, they're made within the body. So that's in contrast to phytocannabinoids. Phyto means plant in Greek. And so phytocannabinoids come from the plant. Endocannabinoids are made within the body. And these are messengers that are made on demand from omega-3 fatty acids. So those great omega-3 fatty acids that you are getting in your salmon, for example, are what make up the building blocks of endocannabinoids. And there are two main endocannabinoids that have been discovered, although others are felt to likely also work within the endocannabinoid system. And these two endocannabinoids are called 2-AG, which lives mostly in the central nervous system and is actually present in human milk. It's present in mother's milk. And so the very first milk that the baby gets has endocannabinoids in it. And those endocannabinoids give the baby a wonderful, peaceful feeling of being loved and getting the nutrition from the milk, and helps the baby bond with the mother. It's really a beautiful situation that's brought to us by the endocannabinoids, and particularly 2-AG. The other endocannabinoid, the first one that was discovered, these were discovered in Israel by Raphael Mechoulam, and the other endocannabinoid is called anandamide, and it's derived from the Sanskrit word ananda, which means bliss or joy, and anandamide is often called the bliss molecule. It's responsible for runner's high. Many of you may be familiar with the concept of runner's high, that you can get this blissful feeling after exercising, particularly aerobic exercising. And we used to think that that blissful feeling of runner's high was due to endorphins and enkephalins, which are the body's own opioid molecules that work with the opioid system. But we find out now that actually it's the endocannabinoid system that produces that blissful feeling, and it's that bliss molecule called anandamide that produces that feeling. It also is responsible for memory, early embryonic development, and many other effects throughout the body. So those are the endocannabinoids. Those are the keys that fit into the lock of these receptors. So the receptors sit on the cell membrane, and they're the lock. And when a key fits that lock, it opens up these effects within the body that are either stimulatory effects or calming effects. And we'll talk a little bit more about those. The endocannabinoid receptors are, there are two main ones that have been discovered, but others that, as I mentioned, are being investigated. CB1 receptors are most abundant in the most abundant receptor in the brain. Of all the receptors in the brain, serotonin, dopamine, glutamate, these other neurotransmitters in the brain are directed by CB1 receptors. So it interfaces with a lot of other different receptor systems within the brain. But CB1 receptors are located in the brain and the central nervous system, but are really scattered throughout the body, as you can see in the diagram. CB1 receptors are responsible for the intoxicating effects of both endocannabinoids and THC. So the reason that people feel high when they use cannabis is because THC binds to this CB1 receptor and has its effects. Now, anandamide also binds with the CB1 receptor and produces the blissful feeling of runner's high. Now, why don't we feel, if anandamide is present in the body and made by the body, why aren't we high all the time? Well, the reason is because endocannabinoids are made on demand. They're only made when they're needed. So it conserves these building blocks, and it allows the body to only respond when it's needed to promote balance, to promote this homeostasis. And so it's broken down very quickly, and these metabolic enzymes are the third part of the endocannabinoid system. We'll talk about these in just a moment, but the THC is not broken down in the same way that anandamide is, and it's not an on-demand system, and that's why THC effects last longer than anandamide effects, which are on demand and produced for a specific purpose of bringing the body back into the Goldilocks zone, back into balance when things are just right. So CB1 receptors also work with motor function and cognition. They regulate release of other hormones, as I mentioned, serotonin, dopamine, glutamate, and so forth. CB2 receptors are scattered throughout the body and mostly outside the central nervous system in places like the immune system. They are present on the cells of the immune system, and we'll talk a little bit more in a moment about inflammation and how endocannabinoids help regulate inflammation, which is a key part of how our bodies work. So it also is, CB2 receptors are also responsible for our pain perception and modulation of pain, neuroprotection, and so forth. So one question that comes up is, why don't cannabis overdoses cause death? And the way opioid receptors do, or the way opioids do. So what happens with the opioid, and the reason people die from overdoses of opioids, is that they get too much. And whether it's fentanyl or oxycodone or whatever it happens to be, when they get too much, these opiates bind to the opioid receptors, and there are opioid receptors in the parts of the brain, the part of the brain that affects breathing. And it basically shuts that off. And so people stop breathing and die because of asphyxiation. Fortunately, and the reason that cannabis is so safe is there are very few endocannabinoid receptors in the brainstem where breathing and circulation are controlled. And so you just aren't going to affect those areas in the same way because there aren't receptors in that part of the brain. And that makes cannabis much safer, for example, than opioids. Good news there. So the metabolic enzymes, again, the three parts of the endocannabinoid system are the receptors, the endocannabinoids, and then these enzymes that synthesize the endocannabinoids on demand and then break them down again. And they break them down very quickly. And so the effects are short-lived and only occur when they're needed. So it really allows the body to fine-tune the effects of what they're trying to do, and trying to bring the body. The sole purpose is just to bring the body back into the Goldilocks zone where things are just right and the cells are able to perform at in optimal conditions. So these enzymes only take effect when they're needed, and there are two of them. One is called FAAH, F-A-A-H, which breaks down anandamide, and the other one is called MAG-L, which breaks down 2-AG. And those enzymes keep the system running well, and those are the three components of the endocannabinoid system. What I'd like to do now is talk about two different functions of the body, and we can take a closer look at how the endocannabinoid system works in those specific settings. The first one is how do endocannabinoids regulate brain cells firing? So within the brain, we have neurons, these brain cells, and neurons communicate with each other. And endocannabinoids are within that system, and they produce retrograde signaling. They allow, if you have, for example, two neurons that are sitting next to each other and one is communicating with the other, if that communication system becomes overwhelming and out of balance, the listening, say you have a talking, for example, a talking neuron and a listening neuron, that listening neuron, if it's overloaded, is able to talk back and produce this retrograde signaling to the sending neuron that I'm overloaded, you need to quiet down. And one way to think about this is I live in an apartment, and if someone in the apartment next to me is too loud, I can go next door and ask them to turn down their music. And that is what the endocannabinoids do. They're able to give that feedback to the sending neuron that they're producing too many signals, they need to calm down, and that is going to bring the neurons back into the Goldilocks zone where things are just right and the communication is optimal. So another system that we can talk about is inflammation, as I mentioned before. So inflammation is the body's response to infection or injury. And what it does is the inflammatory system, which is very complex, it's able to remove germs and damage tissue and bring that part of the body back into the Goldilocks zone, back into balance, and take care of the down and dirty functions that are needed for maintaining that system. So, for example, you have these cells running around the blood system that are set up to detect infection. And if you have bacteria in there, the body's immune system recognizes that and secretes chemicals that start a whole cascade of effects to try to remove the germs. What it also does at the same time that it's releasing these chemicals, trying to recruit other blood cells to come in and engage in the fight, it also releases endocannabinoids, because the endocannabinoids want that inflammatory process to be in balance. We don't want too much inflammation, which is, for example, chronic inflammation is damaging to the body. We don't want chronic inflammation. We just want inflammation to take care of that infection or take care of damaged tissue. We also don't want the body to continue to have inflammation and direct it against the cells within the body. That's called an autoimmune disease, and where the body attacks its own cells. And endocannabinoids help prevent those and keep the inflammatory response in check. And it tells it to do what it needs to do and then stop. And that way we prevent further injury and return the body in that area to the Goldilocks zone. So how do plant cannabinoids like THC and CBD work within the endocannabinoid system? Excuse me, how do they work with the endocannabinoid system? And THC, we're going to dive a little deep. I don't want to confuse people, but we're going to go a little bit deep. But THC binds to CB1 and CB2 receptors. It produces the high. Because of that, it modulates inflammation. It reduces pain, intraocular pressure, nausea, muscle tension. The list goes on, but it does it by binding to the CB1 and the CB2 receptors. That's different than CBD. CBD, which is the second most common compound in the plant, for those of you that aren't familiar with it, THC is the most common compound and does the things that we just talked about. CBD is the second most common compound in the plant. It's non-psychoactive, so it doesn't make you feel high or stoned, which is nice in many cases. And it operates in a number of different ways, which are very interesting. It doesn't really bind to CB1 and CB2 in a traditional sense. What it does do is it increases levels of anandamide. Again, anandamide is that bliss molecule and that does a lot of different very positive things for the body as an endocannabinoid. And it increases levels of anandamide by inhibiting breakdown by the enzyme Pha that we talked about. So it inhibits Pha, and so anandamide builds up in the system and it increases our body's own endocannabinoids and is great in that regard. That is one of the ways that CBD helps in particular with stress and anxiety. You can think of anxiety as being a normal stress response in the body that's out of balance. And anandamide and CBD help calm the anxiety and bring that system back into balance, help bring our brains back into our Goldilocks zone. So the other thing that CBD does is it interacts with a lot of other different systems in the brain. Well, in the brain and the rest of the body, it'll interact with over 37 different receptors of different types, and 12 of those in the brain, 12 different receptor systems within the brain. So it really has broad effects and very positive effects, but it's quite complex. The other thing that CBD does is that it binds to the CB1 receptor. It binds next to the CB1 receptor, I guess is one way to think about it, so that it makes the THC molecule have a lower affinity for the CB1 receptor. So that the THC and the CBD, which produces the high, for example, is greatly is modulated by CBD. And so it's a great way for people who are looking to not be intoxicated to modulate that effect of THC by including CBD in the mix. So CBD has a great effect at decreasing the side effects of THC. As you guys come up with questions, please write those in so that we can address them. But we have just a few more things that I'm going to cover, and then we'll move to questions. So one of the things that you may have heard of is endocannabinoid deficiency syndrome. And that is really a great way to be able to look at some of the illnesses that have been poorly understood by scientists and physicians. So endocannabinoid deficiency syndrome, as you could probably detect, would be low endocannabinoid levels that are associated with certain illnesses like migraines or fibromyalgia or irritable bowel syndrome. These are physicians at some times in the past have thought these weren't even real conditions, but we're finding out now that they truly are real conditions and that they are caused by low levels of endocannabinoids. And so this really explains how treating them with supplemental cannabinoids from the cannabis plant is able to make such a huge difference. Oftentimes, patients who have migraines or fibromyalgia or irritable bowel syndrome find that nothing else works. And they can try a lot of different medications, pharmaceutical medications, and they find that only cannabis is able to provide relief. And that's because cannabis works within the endocannabinoid system, and that's their problem, is they have low levels of these endocannabinoids with the endocannabinoid deficiency syndrome. So it's like having too little vitamin C. You're going to supplement that with vitamin C that you could take as a dietary supplement. The same thing would be true of cannabis as a supplement for these endocannabinoid deficiency syndromes. So it really is a nice way to explain how cannabis is able to provide relief when other medications can't. So another question that comes up is, why do different people have different experiences with cannabis? For some people, they have a negative experience with the psychoactivity, for example. For other people, it makes them relax and calm and feel good. And the reason that people have different experiences is that everyone has a unique endocannabinoid system. And that has to do with the number of receptors that you have, the sensitivity of the receptors in producing an effect within the body, the enzymes that break down these endocannabinoids. All of these different components of the endocannabinoid system are unique to different individuals. And so what that does is it tells us it's not like a pharmaceutical medication where you can say 15 milligrams of this particular medication is going to produce this effect. We don't know that with cannabis. And so a lot of times what you have to do is trial and error to find your best dose. And that's really the key goal as a medical cannabis patient, is finding the right medication and finding the proper dose for you as an individual. And so we'll talk more about that as we go along, but that's the reason why people have different experiences using the same plant, because all of us have a unique endocannabinoid system and endocannabinoid tone. So another question that comes up is, how is it best to dose cannabis if all of us have these different experiences? And that's why the rule of thumb, start low and go slow, is so important, because for a couple of reasons. One is that lower doses often are more effective. There was a study done on cancer patients with pain, and they found that they gave 3 different doses of cannabis, and they found that The highest dose actually didn't help patients. The moderate dose was helpful, but the lowest dose was actually what produced the best pain relief. And so often, this is true with nausea, for example, and other positive medical effects that you're looking for. So starting low is often more effective. The other thing is that you're a lot less likely to have side effects at a low dose, and this includes psychoactivity. And it's nice to be able to get pain relief during the day without being incapacitated by the intoxicating effects of THC. And you can add CBD to the mix to help alleviate that. And the other thing is using a low dose. So it really is beneficial that way. Cannabis and THC in particular is often described as being biphasic. And biphasic means that it has two different effects at two different doses. So for example, anxiety often can be alleviated with a low dose of cannabis. And I often think of the feeling with a low dose is sort of like big sigh, it's going to be okay. Things are going to be okay. Whatever I'm working through, I can make it through this. But at a high doses of THC can produce, actually worsen anxiety and can produce panic attacks and even paranoia. And anyone who's had too much of an edible knows that it's no fun to get too much THC. And unfortunately with edibles, that effect lasts for hours. And so starting low is especially important with edibles. But tuning into that biphasic effect, you want to start with a low dose to try to avoid the negative effects that can be produced at a high dose. Also, using a low dose prevents tolerance, and tolerance is where the body requires increasing doses of the medication in order to achieve the same effect. And what happens is when the body gets too much THC, for example, the receptors are overloaded and they shut down. They say, I don't need all of these receptors because I'm overloaded with THC. So it does what's called down regulation of those receptors. It decreases the number of receptors. And so you need more and more of the medication to produce the same effect. Well, that's not good for the body. And that's called tolerance. You're a lot more likely to get other side effects when you use these higher doses. And what can you do to alleviate that tolerance if it does develop? Well, you can try to prevent it by using low doses, but you can also do something called a tolerance break. Well, what is a tolerance break? Well, a tolerance break is taking a break from cannabis for 2 or 3 days. And what happens is the body is essentially able to recycle those endocannabinoid receptors and replenish them. And there was a study done at Harvard in 2016, a brain scan study, and they found that just 2 days of going without THC basically allowed the body to replenish all of its endocannabinoid receptors and return back to that Goldilocks zone, that just right zone. And one of the things that's important is when you do a tolerance break and you finish the 2 or 3 days that you take a break without cannabis, it's super important to go back to using cannabis at a lower dose because you're going to be so much more sensitive. All of those receptors are up there just listening for THC or whatever the endocannabinoid is, or the cannabinoid. And so it's much more sensitive. So you want to start at a lower dose. I used to tell patients to start back at half the dose of what they were taking before they put a pause on their cannabis consumption. But in talking to patients over time that have done tolerance breaks, I've come to regard that really as a quarter dose, going back to starting to use cannabis at a quarter of the dose that you were using when you hit the pause button. And then you're able to really dial into just the right amount, that optimal amount that works best for you as an individual. What is your what's your Goldilocks dose? What's your just right dose? So those are the main things that I wanted to cover in our conversation. And it's been great talking with you guys. I really want to spend time answering your questions. So Candace, how are we doing? Do we have questions that have come up?
Oh yeah, we definitely have some questions, some really good ones. So the first question is, does hemp CBD interact the same as a cannabis CBD? What is in the body?
That's a really good question. So CBD is CBD. It's a molecule that is the same molecule, whether it's coming from hemp or whether it's coming from cannabis. The key difference in my understanding is that the other chemicals that you get in the plant are going to be different when they come from cannabis. You're going to have a lot more different cannabinoids that come along with the CBD, THC, CBN, CBG, a lot of other chemicals that are beyond our discussion today. Other chemicals as well called terpenes, which give the smell to plants that also have medical effects. There are over 200 different terpenes in the cannabis plant. There are over 100 different cannabinoids that interact with the endocannabinoid system. And so you have a lot of different chemicals within the plant that work together synergistically. And that's often referred to as the entourage effect. The idea is that the medical effects that you get are greater than the sum of the parts, that this entourage is able to give you additional benefits. And that's something that you get in cannabis-based CBD as opposed to hemp-based CBD. Now, I will say that in the way Tikun has done it, there is a Tikun hemp brand for people that live in states that don't have legal medical cannabis. And the thing that Tikun hemp did was, in addition to including CBD in their products, they also include terpenes that come in the plant. And so it really is significantly better than just an isolated molecule of CBD, which you can buy purified CBD that's like 98% pure. It's a white powder, and that's pure CBD. You would not get the benefit of some of the terpenes. Terpenes, for example, are one of the terpenes is called linalool, which is commonly known because it is present in lavender. So you know that it's calming, it's helpful with sleep, it's helpful, has a nice calming effect. And linalool is present in cannabis and hemp in Tikun products, many Tikun products. There are a lot of other terpenes that we could go into, but if that comes up in other questions, we can address those.
That's great. And I did notice the different terpenes that Tikun does add, and that's a good explanation of why they do that. Another question that somebody wanted to know is, can you actually get tested for endocannabinoid deficiency? Is there? Oh,
that's a really good question. And you can, for example, do a lumbar puncture to put a needle in someone's back and take out a sample of the cerebrospinal fluid, which is the fluid that surrounds the brain and the spinal cord. And that can give you information about, for example, anandamide in the brain. We know that anandamide levels in the brains of patients with PTSD are low. So this is an endocannabinoid deficiency syndrome. They don't have enough anandamide. And that's why patients with PTSD do so well with cannabis, because THC mimics anandamide and is helpful in that regard. CBD also increases anandamide levels, again, by inhibiting FAAH. And so you can do those tests, but that's a big deal to put a needle in someone's back, and it's very rarely done. It's really more for research purposes. There is a group at Stanford that is working on developing tests to try to give us a sense of a person's endocannabinoid tone and how things might work best for individuals based on their own endocannabinoid system. part of the problem is, again, these endocannabinoids are made on demand, so, and they are broken down very quickly, so they really don't, it's difficult to measure them at the exact right moment when they should be effective. So that makes the whole process a little more challenging.
That's really interesting to know, though. I never even knew that you could actually test for that. And like you said, right now it is kind of complicated and not something most people would do. But I mean, that kind of gives you a future into the window of, cannabis treatment in the future. You never know, like 20 years down the road, we may have a sensor on us that says, your levels have gone down. You need to bring it up a little bit, something like real time, which is really kind of fascinating. And who knows what's going to happen 10 years down the road. This industry moves so quick, I really wouldn't doubt that we would have something like that down the road.
Absolutely. And another way of evaluating that is looking at our genetic makeup and sort of the 23andMe and looking at your genetic profile. At some point, we're going to be able to say, based on your genetic makeup, what is going to work best for you?
Yeah.
And really have individual personalized medicine based on your genetics.
Yeah, that's amazing. Another question I get a lot of the time, and someone put into the question and answer box here, was what about drug interactions, and especially those kind of drugs that have grapefruit counteractions? Should people be careful of combining those?
Yes, that's a really good question. And overall, we know that cannabis is a very good actor. It doesn't interfere with most medications. And we know this from the studies that were done on Epidiolex. Epidiolex is a primarily CBD compound that is the first medication that was approved by the FDA derived from cannabis. It's derived from the whole plant, but it's almost all CBD, and it's approved for certain types of seizures in children. But they went through a lot of great research in the process of developing Epidiolex, and there were interactions with some of the anti-seizure medications. So I would say if you are taking medications and you have a seizure disorder, that's something that you definitely want to go over with your physician. The other thing I would say is that CBD can have an effect on the liver and how the liver enzymes break down other drugs. And some drugs, like the blood thinner warfarin, is impaired. And so you can get a greater effect of warfarin with a lower dose. So what that means is you want to work with your physician. They do tests to try to find, the best range for the medicine, but you want to be very careful about that. And you might wind up using a lower dose of warfarin if you're going to be using it with cannabis. So fortunately, cannabis is a good actor, but there are a few medications that will have that effect.
Yeah, that's why I always recommend people that are wanting to use cannabis that are on medications, go and see a cannabis physician or talk to your own physician if they feel like they're educated enough. It's really not an expensive process nowadays. It gives you that peace of mind. And then you also get that recommendation at the end of the day that gives you discounts and tax savings. So always better to play safe than be sorry,
I really agree with you on that. And cannabis is it's one of the most complex plants on the planet and one of the most beneficial medically, but having an expert who knows the cannabis plant and knows your medical condition really gives you an upper hand in getting the best results from the medication as possible.
Yeah, definitely. Someone also asked, what's the best Tikun product for immune support? So if someone was trying to boost their immune system.
That's a really good question. I would say it depends on what your goals are. If you are looking for something that you can use on a daily basis, that you need to be fully functional, I would use something called, one of the strains called
Avidecal?
Avidecal. Avidecal is a 15-to-1 ratio of CBD to THC, so it's almost all CBD, although it does have a small amount of THC, which helps the CBD work better. And it has a very nice terpene profile as well, with pinene in it, which really helps with focus and memory. So it allows you to be very functional during the day while still getting the benefit of the CBD. If you're looking for something that I would say, if you can tolerate psychoactivity, then using a low dose of something called Alaska is a very good one. One of my favorite strains of Tikun products is called Midnight. It's a 1-to-1 ratio of CBD to THC. So it's a nice balanced mixture. It also is high in the terpenes, linalool and limonene. Limonene elevates the mood. So if it makes you feel better, it's particularly good for people that have anxiety or depression. And it's a very nice, balanced, mellow medication that has the benefits of equal amounts of CBD and THC. So I like Midnight a lot too.
Perfect. Yeah, I do a lot of recommending of all the Tikun products, but especially the Avidecal. So, one question about the testing. So first of all, I want to ask where people can access the studies. And then someone's asking, when testing the effectiveness of the products, which benchmarks are used, like inflammation, brain activity? Do you happen to have an answer for that? It's
well,
probably
first,
anecdotal and test results, like looking at blood levels and stuff.
Say again.
What do you guys test maybe afterwards, like the patients, like based on their anecdotal results, and maybe doing like blood tests to see if like the levels have like balanced out and stuff like that?
Most of the studies have looked at people's responses. For example, patients with autism that were in the video. Those patients will often be able to decrease their use of other medications because of the use of cannabis and the fact that they're having fewer rage episodes, there's less violence, they are able to dress themselves, they're able to have greater social interaction and advancement in their cognitive functions and what they're able to do. They're able to take a shower themselves or dress themselves. So there's a lot of different things that we can look at. Seizures, you can look at the number of seizures, the duration of seizures. Patients often are able to get off of other seizure medications when they find the right combination. And they're having a laboratory test is often difficult. We just don't have those laboratory tests for a lot of the things that we're looking for. And so we have to look at these other markers.
Yeah. Last question here. We've had some really good questions and this hour's just flown by. But people wanted to know, are there studies done with terpenes or the entourage process that people can be directed to? And then are terpenes added to the Tikun products, or are they naturally occurring with the cannabis?
Really good questions. So let me answer the last one first. The great thing is that Tikun strains were developed for medical efficacy. They were not developed for maximum THC levels, maximum harvest, all of these other things that other strains from other companies often are developed for. They were developed specifically for medical indications. So the plant, you want the plant the way it appears in nature because that's been studied and shown to be effective. So you want all of the terpenes the way they occur naturally in the plant. And what Tikun does is it is batch specific. So they extract the terpenes, they extract the cannabinoids, and they combine everything in the same way from the same batch. So you know you're getting everything. Whole plant medicine is what it's often called. And what you want is the whole plant, because you know from studies that have been done that those whole plants are effective, and you get all of that with Tikun products, which is a real advantage there. Remind me again some of the other question, part of the
Where
question.
somebody can find information about the entourage system and research on terpenes.
So, and this goes back to the other question. To access Tikun research, you can go to the Tikun website, which is tikunolam.com. And it's the way it appears in my email. And you can go to all of the studies are there and you can access any one of them. There is a study that was done on CBD that looked at purified CBD compared to whole plant CBD as a Tikun product. And what they found was, it's a little bit complex, but they found that it works much better. They found that not only were the patient's symptoms treated better, but also they had a bell-shaped curve, dose-response curve in purified CBD, which is not what you want. What you want is a dose-response curve so that the higher the dose you give, you get more of an effect. And that's the way drugs that operate best in the body operate. With a bell-shaped curve, a higher dose is going to produce a less of a positive response, and that's what was true with purified CBD, whereas whole plant CBD, because of the entourage effect, gives you a much better response. Not only that, but often because you're combining it with these other chemicals in the plant, you're often able to use lower doses. Yeah. A good example of that is Epidiolex. Often kids would be taking hundreds of milligrams of CBD of Epidiolex because they needed to keep the seizures down under control. Whereas if they're using a whole plant extract, say from Avideckel, the high CBD Tikun strain, they're able to use a much lower dose because they're combining it with these other chemicals in the entourage.
That's a good point. I'm glad that you were able to bring up that research because I've also heard that same thing, and that's something that people should know, the differences and how they're both beneficial, but one is still, more beneficial to you. I know we still have a couple questions out there, but we've run out of time. So please feel free to email Dr. Dan to check out his website, which we have listed there, or else you can email me. Thank you.
By the way, if you would like a personal consultation, I do those in person and online. Most of them online now, actually, especially with COVID-19. But you can just go to my website, it's on the screen, drdancannabis.com, and you can request a consultation. And I love to interact with patients, and it's a way to really try to get a very personalized treatment with cannabis in a way that's going to work best for you.
That's amazing. I'm glad that you got to share that with everybody, and I'll definitely be sending people to that website. Thank you so much for joining us, Doctor. This has been great, and thank you to our audience who's been with us. I know that I learned a lot. I loved the metaphors that you gave us. It really helped us understand, and I really liked how you talked about the dosing, and also about tolerance, because I think that's really important. And I hope that we were able to share some information with everybody watching that will help them become better informed cannabis consumers, and that you will be able to find some relief. So thank you, everybody, and we'll see you for another episode.
Thanks, everyone.